Good morning, guys. This is Kiza from the Earwax Specialist again with another one of our procedures. So this is a patient who's come in, and you notice there's quite a dense plug of wax which is sort of sitting in almost in the isthmus and the second bend, where the ear canal just slightly narrows. And obviously this is where we generally find most plugs become unstuck, for want of a better word. So what we're trying to do is we're going in with a 2mm Zollner. We're trying to move the plug medially from the middle of the cavity just to see if you get any movement. And first thing I've noticed is that it's quite tough to the touch. So I've just adjusted things, and I'm just going in with a St Barts hook just to remove this layer of keratinous dead skin at the entrance. This is usually the quite dehydrated part of the wax, which usually forms its surface layer, which is quite difficult to latch onto with the normal Zollner suction pen, because there doesn't ever seem to be enough suction when you're trying to remove something of this consistency. So now what we're doing is going in with the St Barts hook and just easing away these layers of wax and dead skin. And now that we're in the softer underbelly, what I've done is I've changed tact and gone back in with a suction pen. Of course, I'm completely aware that the view isn't the best here, guys, so these videos aren't necessarily designed for perfect viewing pleasure, but they're designed for educational purposes for the microsuction practitioners. So as you can see, as we're easing this off from that superior quadrant, again I've loosened it enough to go back in now with a slightly different manual instrument, and this is a Jobson horn with a rounded edge, and it allows you to get a really good grip. So we removed a huge plug there. You might just missed it on its way out, but it leaves this keratinous dead skin, which is this soft slushy sort of skin which hasn't been able to migrate, which has actually migrated off the eardrum but hasn't been able to move out of the ear. And obviously it's been stopped by that big plug that was in front of it. The problem there is that it's not really getting any sort of air to it, so you often find that it has this very sludgy sort of appearance to it, and that can sometimes lead to rise to infection in the pocket between the plug of wax and the eardrum itself, where it gets really humid and wet, and you sometimes get a little bit of water in there, and you get a Pseudomonas infection. So you can see the general condition of this ear canal isn't the best, so there are some signs of possible infection here. So what we're removing is as much of this keratin and this dead skin as we possibly can, just to allow for normal migration and the normal life cycle of the canal to start to take effect, rather than have all these debris inside the cavity, which often, if you leave it there, there's obviously a greater chance of infection. Of course, you don't want to move too much away because the ear's got a natural flora, but in this instance, this debris does need to work its way out the ear. So you can see the general condition of the ear canal: quite red, quite tender, quite inflamed. I am going to be referring the patient back to the GP after this, just for them to get have another look into the ear to see if there's anything they would otherwise do. But that's it. That's all done.